I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, naturopathic doctor. What supplements do you take, Jordan? It's honestly one of the most common questions that I will get in like an Ask Me Anything style thing on social media. So I wanted to talk about it because I am going to tell you the answer. I promise that this is not like a clickbaity title. I will tell you, but we're going to do a little exercise first because I think just even wanting to know that answer, we got to explore that a little bit before I tell you the answer so that you can actually receive the answer and not just be like, oh, okay, creatine, got it. You actually have to think about why you want to know this first. I think it's really common for us to look for community, to look for sameness in each other. And the world of like wellness and nutrition and supplementation sits in this weird spot in medicine where there is much more morality associated with it, right? Do you feel like a good person if you had a salad and you're like a bad person if you eat a chocolate bar? We don't always look to medical professionals to give us this kind of advice. And I think that's partly because they are not that well trained in it. And maybe the professionals who are well trained in it, like me, maybe would feel inaccessible to some people. Often it's out of pocket, private healthcare. Or maybe it's not a value, right? And we haven't considered putting time, effort, and money towards that education because we feel like this kind of information is just around, right? Like if you can go and Google it, then maybe we don't need a person to tell us what to do. Whereas when we're looking for prescriptions, our doctor's like a gateway to getting access to certain things. And so we feel maybe like we should just get this information by osmosis since we have a smartphone. And then there's other information that we're going to go to a professional for. I'm not sure. I've thought about it a lot. But there is definitely more like community building and us wanting to have sameness around health and wellness conversations and topics where we want to be part of a group, right? A group of people who eat a certain way. We want to be associated with people who take certain supplements. We see people and we aspire to be like them. And so we try and mimic or model the habits or behaviors that we see them doing, even if maybe those habits and behaviors are not related to the way they look or the way they present. We still want to be like them. So we want to try and like do the things that they're doing. I think this is why we seek these kinds of answers from the people that we look up to. And I even remember, like thinking about like your 17 magazine, right? When it would be like, what's so-and-so's skin routine? And you'd be like, yeah, I want to know that. It's that same feeling, right? It's like they look healthy, they look good, they are successful. Like I want to know their bedtime routine because that must be the secret to what it is that they have. And I'm going to try and mimic that so that I can get that. So I think there is some of that. I think we also ask because we are looking for validation on something. Often when we're looking at integrative medicine or we are looking for solutions, we're looking for hope, right? We're looking for validation that the path we're taking isn't cray-cray. even though maybe it can feel that way because it might be a little less conventional. Maybe you are trying to go down a path that your partner's not on, right? Maybe they don't eat healthy or don't take supplements, and here you are thinking about exploring that. And because you don't see it in your own household, you're going to try and find someone else who's doing it so that you feel more validated in your habits. I think that's possible. I think it can make us feel hopeful if you've struggled with a chronic condition or chronic symptoms, or if something feels in your family history or in your genetics, and you see someone overcoming some of those hurdles with their habits and their life, that would maybe make us hopeful. I think one of the reasons we have such a difficulty with staying power in so many of our health habits is because we've tried a lot of things and we don't feel that hopeful that things are going to change. And so when we see someone else doing a thing and they're having success, again, even if their success is not tied to the thing that they're doing, we feel more hopeful about it and then want to mimic it. And so that can feel good. I think it can also help us feel safe. There's conversations about whether or not all supplements are safe in all situations. And again, if we see someone that's similar to us doing something, then we can get this, I'm going to call it an illusion of safety, because unless someone's prescribed something to you, we really don't know if it's safe. And so I think it's an illusion of safety if we see our sister is taking some supplement, and so we're going to do it too. I think these are lots of reasons why we do ask this question in the first place. I want to be like that person. What are they doing? I want to feel heard and part of a community and have sameness. So I want to do what they're doing. I want hope. So I'm going to do what they're doing. Right. And then there's definitely, one of our human biases is called the halo effect, where we tend to put certain people and certain behaviors on pedestals in our mind. And it means that we actually don't have a great or easy time making more rational or logical decisions about it, right? I always use Gwyneth Paltrow as an example. And if you're listening, I'm sorry that I use you as an example. You just are so perfect in this instance. Is that we'll put someone on a pedestal like Gwyneth Paltrow, and then the behaviors or things that she does gets this like halo around it, where we're not as willing to examine what the truth or the reality is around the things she recommends, because she's a star, right? And celebrities are easy to see how we may be like, oh, maybe I should do that with my vagina because that's what Gwyneth Paltrow is doing. Although questionable whether or not she's actually doing any of the things she promotes, but it's easy to see it when it's a celebrity. We will do that same thing with others, right? Like you might even do it with your mother, where the things she does and the things she says about, certain health behaviors or whatnot, you're holding them in a different regard because she's your mother. You will do that when I tell you what supplements I take. I'm not a celebrity, but because I'm coming from that position of power from a knowledge sense, and I have a microphone, which is, that does give this again an illusion of knowledge and power. And you can see that in other podcasts that are talking about things that are just quite frankly crazy, and yet we hold them in high regard because it's like on a podcast. So when I tell you my list, you have to really think about like, why did you want to know? Because it's not like you're curious about my health, right? That's not actually the reason you'd want to know, even though you might just be like, I'm just curious. You're not, right? There's something that makes you want to know this. And so the reason that I'm prefacing, and I promise it's not clickbait, I am going to tell you, the reason you want to know is somewhere in what I just said. And so it's really important that you think about that, because when you come out the other side of hearing my kind of boring list, truthfully, you got to ask yourself, like, that really shouldn't change your behaviors. it should maybe spark some curiosity for you whether or not someone could help you pick a supplement list that's going to get you on a path towards health or wellness or whatever. That's maybe how I want you to feel when you come out the other side of this podcast, is that you should feel maybe inspired that there are a few things that you could take. If you're taking like 9 or 10 supplements in a day, I maybe want you to feel inspired that you don't need to do that. Unless they've been prescribed by your doctor or naturopathic doctor. But again, like, ask yourself the question of like, why did you want to know, so that you come out the other side with the right information, or information that actually helps you. Okay. And maybe you're just going to listen and hear my decision-making process and go, like, there's intentionality there. There's reasons why we're doing some of those things. I could probably have some nutrients that I took with intentionality that would help me in my health journey. That's kind of what I want you to feel when you come out the other side. Okay. So thinking about all those things. Do you want free advice? Are you looking for validation? Are you looking for sameness? Are you looking for help? Are you looking for validation around safety? Right? Is there a halo effect happening? What is it? Okay, so what do I take? Now, I am not a particularly good supplement taker. I have tried a lot of strategies. I even at one time bought myself like this $200 light up supplement case that was connected to my phone that would text me if I hadn't taken my supplements, and it would light up at the time of day that you were supposed to take your supplements. I'm just not good at it. There's only one that I'm good at, and it's my melatonin at bedtime. That's it. The others, I do my best. But like, honestly, I'm really not that good at it. I wish I was better. And I think part of my challenges are that I generally feel pretty well. So in the periods of my life where I've been really consistent with supplements, there was a time, and I'll come back through these, I promise. I'm just riffing them off right now. There was a time where I took St. John's wort very consistently, and it's because I didn't actually feel that well. And so the daily reminder of those symptoms was easy for me to take them. Whereas right now, I generally feel pretty well. And I also have other strategies to help some of the things that I supplement around, like recovery, etc. And so those symptoms are not like in my face enough that I remember to take it. I find taking supplements for prevention or for wellness, or even if I was going to like play around with sort of a biohacking kind of way of taking supplements, which I've done in my lifetime, those are the hardest for me to remember. I'm way better at being like, I'm sick, I'm going to take a thing. That works way better for me than taking things regularly. I also probably don't have my supplements in enough spaces, and some of them are powders and some of them are capsules and some of them have to be taken with food. And so I struggle because my schedule can be quite irregular, where sometimes I'm leaving the house without having eaten first. Sometimes I'm putting protein powder dry in a container and not making the smoothie until later. And that would maybe be a vehicle for taking some of my supplements. Sometimes I work from home and then I delay my breakfast, or I eat really early and then get to work and forget to take my supplements. So my irregularity in my schedule really doesn't help me. The thing I do very consistently is go to bed. And so that I find super easy to take. And even I've tried putting my other supplements with my melatonin, but then there's no water and my melatonin is chewable. And so it's like, and I know like honestly, these are your reasons too. Like, I've listened to you guys for the last 15 years about why you can't take supplements. My reasons are exactly the same as yours. So when I say I'm taking something, it's generally a bit irregular, or a bit more haphazard than it probably is supposed to be. The only thing that I can get away with that with is vitamin D, because you can take it haphazardly and still have the same effect. I wish everything else was the same, but it's not, unfortunately. So my current list is actually relatively short. So I do take melatonin and I do take it consistently. There's probably a bit of a placebo component to that now, to be honest. I do have migraines. I do have period cramps, and those are great reasons to take melatonin. And so I find that it supports my falling asleep, and helps me like get into that bedtime mode. There is some research on kids with ADHD using melatonin to help reduce their I'm going to call it bedtime procrastination. That's not what they call it in the study, but essentially kids with ADHD take way longer to get to bed than kids without. And when I read that paper, my kids were a little bit older and I was like, yes, this explains things. So I do take that really consistently and have for a long time. It's kind of I travel with it. Like that's one that is really part of my life. I probably could go without it, but that is one that is generally part of my life and has been for a long time. I don't have side effects from it. And some people do, right? Some people can be groggy in the morning or have rebound headaches or nightmares. That's not a thing for me. And so it's one that can just be done really consistently. One I wish that I took more consistently was my iron. And that has taken me a long time to find an iron that I actually like, that doesn't cause any digestive side effects. And that when we read the research on iron, the research is like, yeah, this is going to give your patient side effects. Like it's just one that like we just know. And almost all the discussion around iron online in the research right now is around compliance. So how can we put it in a little blister pack? Can we, how do we give patients instructions around iron that's going to help with compliance? They are just trying to do research to help me, apparently, because I have difficulty with my iron compliance as well. It's better than it used to be, partly because I'm working on hair growth. And so I'm taking it probably 4 days a week. And that's decent for me to take something that consistently. But really, if I was going to be more diligent about it, I would take it every day, and I should really retest my blood work in about 8 to 12 weeks. And so if you've been on iron for a million years and it hasn't helped your iron status, it's not helping. Like it's the wrong one. We should see change in your blood work within 12 weeks if you're being consistent and the iron is actually the right form. So for me, if I truly wanted to check in on myself, I could probably use labs to validate that I'm not taking it often enough, even though I actually just know that. But for you, when you go for your lab work, if your iron hasn't changed, it's either not helping, it's not the right dose, or you're not taking it often enough. So that would be that would be the next in line. The one in line after that would be creatine. And I have gone through phases where I'm really consistent with my creatine. It really follows my training schedule, which it shouldn't. I actually should just take it really consistently. I am one of those people that does find that creatine causes a little bit of water retention when I start taking it. The problem with my lack of consistency is that I never take it long enough to know at what point does the water load kind of settle out? Because in theory it should, right? If you feel bloated when you take creatine, it should go away, that feeling after a little bit. I never take it consistently enough to know like, oh, by 2 weeks, it's gone. That never happens in my world, but that's what should happen. But creatine, from a recovery mental health perspective, is really important for women. And so I'm a huge creatine pusher, but I'm not particularly good at taking it myself. And part of it's because it's in a powder. And like I said earlier, my protein powder and smoothie situation varies really from day to day. And I do fall into a little bit of a trap with my creatine where if I miss one day, I like totally sabotage the habit, and that shouldn't happen. I should just take it. Even if I got it in 3 days a week, that would be winning compared to now. But I definitely have this, well, I missed a day, and if I'm not going to do it consistently, like F this, put it in the back of the cupboard. I really should just take it inconsistently. because that would be better than nothing. I am an omnivore and I eat a lot of protein. And so when your diet has lots of protein, you're probably not deficient in creatine, but we do know that going above and beyond those dietary recommendations, especially for women, like we have a harder time meeting our own needs, that recovery is better, performance is better. And then there's some emerging data on mood that I'm quite excited about with creatine. So that one comes next in line. Then vitamin D, which I live in Canada and we don't see the sun. And I think this winter was even like particularly bad. I remember I don't listen to a lot of like local radio, but I was listening to local radio on my way to work and they were commenting on how, and I don't remember the numbers. I just remember how depressed I was when I heard this stat. They were like, we were supposed to have had like 2 hours of sunlight between November and now, which was sometime mid-January. And they were like, and we've had 7. Like it was just like ridiculous how little sunlight we'd had over the previous 90 days. But vitamin D is something that should be tested. So this is not, do not take vitamin D without it being discussed with your healthcare provider. Depending on where you live, you probably can't access vitamin D in a dose that is required for you. The over-the-counter vitamin D is at the public health recommendations, which is 2,500 IU in Canada. They upped it over the last couple of years, but exceeding those numbers requires a prescription. And so you need to speak to someone if you are going to take more than what you can find over the counter. So those are the things that I take. I can't even say the word regularly without like rolling my own eyes at myself. Those are the things that are on the roster currently. Not a big list, right? Definitely not a big list. But other, like, because I'm relatively healthy and I don't have these like big health goals right now. Most of my goals are around recovery, and trying to increase my iron, right? Those are my personal health goals right now. Now, there are other things that have been in the list or been in the rotation over the years that I've taken with some consistency without. I did mention St. John's wort. I have taken that consistently over a period of time. I've also taken saffron for short periods of time. I've also taken Prozac for short periods of time. I've taken fish oil and still have fish oil in my cupboard and will sometimes, take a bunch of it when I'm working on recovery or struggling with my recovery. And I also take turmeric. Actually, that one, turmeric probably should have been in the list before. I do have chronic knee pain, which only in the last 3 months have we had any clarity around, but I thought I had horrific arthritis. And I don't. So I haven't taken the turmeric for that purpose, but the evidence for turmeric for joint pain, specifically for arthritis, is very positive. It's like the most positive supplement research we have for OA, osteoarthritis. So I do take turmeric for that anti-inflammatory effect, and it does help with acute pain. Not as good as the Advil, which I also take. And I've also had periods when I've taken estrogen when I struggled more with some symptoms in and around my period, probably related to dieting around like weight class sport. Depending on my body weight or body composition, I will get hot flashes in and around my period. And I don't have that problem right now because that is not, my body composition's not hanging out in that range. So I don't take it. Please notice that I just listed estrogen as a drug, Prozac as a drug, and Advil as a drug in my list of supplements that I have taken with some regularity over the last 10 years. How come? The supplements that I take or that I would ever prescribe to a patient is with purpose. And that's my value. You might have a more, I always use the word biohacker, and I want to explain what I mean by that word. Biohacker is like, we don't know this yet, but I'm going to take it anyways. or this nutrient is involved in the chemical reactions in my body that are related to something that I want to do, like autophagy or inflammation or the immune system. And so I'm going to take them even though we don't have any human clinical trials to show that it's helpful. If that's your value, take whatever you want, right? Like if you're trying to like increase your antioxidant status and lower your free radicals, like by all means, take some glutathione, take some green tea. That's not how I practice my own health right now. It's not a value to me right now. I do a lot of other things like an incredible amount of exercise that, in my opinion, is giving me the longevity benefits that I need, and I don't want to take a supplement. Obviously, I'm not very good at it either. But if that's your value and your goal, by all means, right? Where I struggle with supplements is when people don't understand the difference between those two things. So when I say I take turmeric for my joint pain, it's because we have like 100 studies of giving people with joint pain turmeric and it gets better. If you're going to take turmeric because it's antioxidant, anti-inflammatory for longevity, remember that we have 0 studies that show that, but in a petri dish or a test tube or a mouse, right, or on paper, we show that turmeric does things, and those things may be related to longevity. There's a huge difference between those two things, in my opinion. Where I want to spend my time, my money, I'm going to put my money on my turmeric for my joint pain, not for my lifespan. But there's lots of people who have their health as a hobby and they want to take supplements for longevity, and they're like, if that mouse lived longer, like I'll take 2, right? Like pass me the turmeric. That's just not how I live. That's not how I practice. And that's not really how I ever prescribed either. I really want to stick to hard clinical data, and because if we move away from that, we're actually talking more about a value than we are about medicine. And totally cool to take supplements based on your values. But as your practitioner, I was only ever going to choose things for you that I knew we had hard clinical data on. And that's actually how, when we built the Confident Clinician, which is my practice resource for clinicians, that's where we live. We live in the hard clinical data space. And if patients want more, that's great. But as your clinician, how can we ethically say, take this turmeric, you'll live longer, if we've never studied it, right? Like we just can't. So I put those drugs in the same camp because all of the things that I take are being taken with the same intentionality. And I talked about this at the beginning. I have a symptom, I have a goal, I have a challenge or a problem, or I have something I want to work towards. So I use something that's been clinically proven to help with that goal. And I do it for the period of time that I need it to achieve the goal. And as the symptoms resolve, as my life changes, as my needs change, as my goals change, so do the things. Right? I'm not taking supplements that I took when I was 20 because I'm different. Different and also still immature. Your life changes, your needs change, and those supplements should change, right? I no longer take support for my mood. Arguably whether or not I probably could sometimes, to be honest, but that's just not a thing right now. But my Prozac sat in the same priority sequence as my other supplements at that time, right? Like they're the same. They should be treated the same. They should be thought of the same. And I think that's where, when I come from this space where I want you to feel more confident about the decisions you're making in integrative medicine, it's because we have evidence for what you should be doing. Right? Remember at the beginning when I said we sometimes make decisions about supplements because we want to feel like somebody else? We would never do that with their medications. I mean, I guess sometimes we do. Oh, like my Aunt Mary took this blood pressure medication, so it must be fine. We do that way less with drugs than we do with supplements. But in theory, we have the same research to support the use of supplements. And so if you're feeling confused about what to take, the missing piece of your journey is probably the practitioner. because you're not going to find the answer to your needs in a podcast, right? Because I can't take your history. I can't hear your goals. I can't understand your blood work. And that's actually how we get to make decisions about supplements, which is amazing, right? And yet they still kind of live in this space of, similar to like, do you want tofu or chicken, right? So that's my list. It's the most common question that I get asked on social media right now is, well, what supplements are you taking, Jordan? And now that you've heard it, I want you to reflect back on what we talked about at the beginning. Like, why did you want to know? Why did you open this episode? And how can you use that curiosity that you had to help fuel you towards finding a solution that's actually going to work for you? And hopefully what this episode did was give you hope that carefully chosen supplementation can improve your health. And you don't need to take 9 things, but you also probably need some help picking them, right? So that you are doing something that's going to get you where you want to go. All right. And lastly, and I know we have this disclaimer at the end of every podcast, but let's please remember that today's episode does not constitute medical advice, nor was a medical relationship formed by me telling you which supplements I take. This is not a license for you to go and take those same supplements, because you listened to the first part of the episode where I said that that's not a thing and you shouldn't just follow what other people are doing. I shared with you what I'm doing to help you understand decision making around supplements, not so that you could go and copy my list. Okay, so please don't go ahead and take a bunch of things without getting some medical advice. I hope you enjoyed today's conversation. I'll see you next week.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.